Hello, and welcome to this podcast on trauma and PTSD. In today's podcast, we're going to be covering the definition of trauma and what it is, how trauma can make someone feel, the different types of trauma, what PTSD means, the symptoms of PTSD, how to get a diagnosis, the different treatments that could be offered to someone suffering with PTSD, how to support somebody who is struggling with trauma or PTSD, and finally, some support links at the end. First, we are going to look at the definition of trauma to understand exactly what this term means. So, the definition given by Mind is that trauma is when we experience very stressful, frightening, or distressing events that are difficult to cope with or out of our control. And the definition in the Cambridge Dictionary is severe and lasting emotional shock and pain caused by an extremely upsetting experience or a case of such shock happening. So essentially, it's all focused on emotional distress that can cause a lasting impression. Trauma affects people in very different ways, and it's very dependent on the individual as to how the trauma can present itself, and also on the type of trauma and how it's happened. Some of the common causes of trauma are one-off or ongoing events, being harmed or neglected, being a witness to someone else being harmed, living in a traumatic environment, and also family trauma. Trauma can present itself in many ways and often makes people feel frightened, rejected, nervous, anxious, or like their thoughts and feelings aren't valued. There are some groups that have been found to have a higher likelihood of experiencing trauma, and they include people of colour, people who have served or are in active service in the military, those who are in prison or have previously been in prison, asylum seekers and refugees, the LGBTQIA+ community, and those experiencing poverty. Next are some of the different types of trauma that people can be diagnosed with, and general trauma can alter the way the brain functions, especially in areas of the brain that are involved in emotional regulation, memory, and the response to stress. Taking this into account, this can lead to someone having a heightened sense of alertness, trouble with memory, trouble with telling the difference between what is real and what is imagined, and it can also cause difficulties with focus and solving problems. The first type of trauma we have is called acute trauma, and this is a result of a single incident, such as an accident, being assaulted, death of a loved one, or a natural disaster. This type can cause symptoms such as intense fear, intrusive thoughts, flashbacks, and emotional detachment. It can also cause physical symptoms like increased heart rate, sweating or getting the chills, exhaustion, and also nausea. Then we have chronic trauma, and this results from a distressing event that is repeated or happens over a prolonged period of time. Some examples of this could be long-term abuse, domestic abuse, cyberbullying, and also war. Next, we have complex trauma, and this is a result of multiple traumatic events which are usually of an invasive interpersonal nature, like neglect, child abuse, or betrayal. Developmental trauma, and this happens in childhood, and this type interferes with the healthy development of emotions, and this can be caused by events like abandonment or care that is inconsistent. Finally, we have secondary trauma, which can also be called vicarious trauma, and this happens when a person is indirectly affected by trauma experienced by others. For example, it's commonly seen in therapists, first responders, and caregivers. Next, we're going to look at PTSD, starting off with what does PTSD actually mean? So PTSD stands for post-traumatic stress disorder, and the definition given by the NHS is post-traumatic stress disorder is a mental health condition caused by very stressful, frightening, or distressing events, and an estimated 3.9% of the world population has had PTSD at some stage in their lives, according to the World Health Organization. There is also a type of PTSD called complex post-traumatic stress disorder, or CPTSD, and both of these conditions are clinical mental health conditions developed after a traumatic event, although not everyone who goes through trauma will develop this condition. People process things in different ways as factors such as genetics, previous mental health history, the severity of the trauma, and the support that someone has all play a role in the way that someone deals with and processes their trauma. Then we have some of the symptoms someone could experience when they're suffering with PTSD. And like with most things, this will be very individual to each person. Some might experience a number of these symptoms while others could experience less. So, symptoms of PTSD will generally fall into 4 categories: intrusive thoughts, avoidance, negative changes in mood and thinking, and changes in physical and emotional reactions. Some examples of each of these categories would be flashbacks, distressing memories, and feeling like the trauma is happening again, all come under intrusive thoughts. Avoiding certain places, people, or activities that remind you of the trauma, or not talking about what happened, are examples of avoidance. Having persistent negative thoughts about the world or yourself, feeling guilty or shameful, and feeling emotionally numb are examples of negative changes in mood and thinking. And finally, being easily startled, not being able to sleep or concentrate, being hypervigilant or alert all of the time, and being more irritable or aggressive are changes in physical and emotional reactions. So now we've covered what PTSD is and how it can present itself, what happens next if you're looking for a diagnosis? The first step is to always contact your GP, and once you've been seen by your GP and talked through your concerns and symptoms, they will refer you to a mental health team or specialist if the symptoms persist for more than 1 month and are interfering with your daily life. The NHS use a criteria called ICD-11, which stands for International Classification of Diseases, and in some private settings a criteria called DSM-5 is sometimes used, which stands for Diagnostic and Statistical Manual of Mental Disorders, and both of these methods are comprehensive systems that are used to classify and diagnose mental health disorders. Next, we're going to look at some of the treatment options available for PTSD and trauma. There are a few different methods that are commonly used to treat trauma and PTSD. The first is by having therapy, and specifically trauma-focused methods such as cognitive behavioural therapy or CBT, cognitive processing therapy or CPT, and eye movement desensitization and reprocessing or EMDR. There are other types of therapy that can also be used, like prolonged exposure therapies, group therapies, and dialect behavioural therapy, or DBT. Medications can be suggested, such as antidepressants, which have been found to be effective in treating the symptoms of PTSD, and in more severe cases, antipsychotic medications could be used if there are symptoms of psychosis or severe hyperarousal. Support groups. So there are professional support groups that are usually led by a counsellor or a therapist, and they provide a safe and supportive environment to deliver therapeutic interventions and psychoeducation. There are also peer support groups that are led by people who have experienced trauma personally, and these can be great for talking to others who understand how you feel, and this can also help with reducing feelings of isolation and improve self-esteem and confidence. Self-care strategies, and there are many different types of self-care options that you can do to help you feel better, and this will be individual to each person. Some examples are the 5-4-3-2-1 technique, which involves alternating attention between your 5 senses. And to practice this, find a comfortable position and focus your attention on 5 things that you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing that you can taste. Write or mentally list 4 or 5 things in your life that bring you joy, visualizing each one of them briefly, or repeat positive mantras to yourself such as I am safe now or I am in control. You can physically ground yourself by touching an object or running cold water on your hands, or find a creative activity that you enjoy, such as colouring or journaling. Focused breathing can help to regulate the nervous system and reduce feelings of anxiety. So there's a technique called box breathing where you sit or lie down comfortably, inhale slowly through your nose to the count of 4, hold your breath for 4 seconds, exhale slowly through your mouth for 4 seconds, and then hold your breath again for 4 seconds. Or you can try different deep breathing methods. And finally, there is mindfulness meditation, which helps to encourage you to focus on the present moment by concentrating on your breath or the sensations in your body. Regular meditation can help regulate the body's stress response, and this encourages relaxation, and it also helps to promote better sleep. It can sometimes be difficult to know what to do in a situation where someone is suffering from a mental health condition, but there are some really simple things we can do to support someone through their journey with trauma and PTSD. First is to simply listen. Often people just want their feelings to be heard and validated, and just being there with them will help hugely. Don't be judgmental. People develop trauma from a number of different situations, and then people could potentially be battling with feelings of embarrassment or guilt. So creating a safe space for them is so important. Try to understand their triggers and of course respect their privacy. If they're not ready to talk about a specific part of their trauma, then don't push them. Just let them open up in their own time and be as supportive as you can be. Trying to do other activities can also be helpful, and making sure that you have support yourself, as it can be hard to support someone effectively if you're struggling yourself. Finally, we have some support links. First is a link to Mind, and this specifically is a link to a list of support that they recommend, specifically for trauma. And aside from this, they have great resources for lots of mental health conditions and other support available. Then is the Royal College of Psychiatrics link, and this takes you to a page on coping with trauma and professional help that is available. PTSD UK are another organisation specifically for people who are going through a PTSD diagnosis or looking for more information on the condition. And finally is a link to the NHS website of how to access talking therapies. That is the end of this podcast. If you're interested in any other topics, you can find them on our subscription site. Thank you for listening.